I believe it. I believe it because I feel like no one really had anything bad to say about that course, and so I'm really excited. But that's also like really cool what you're doing.
Having like really good friends that you can study with, that
Yeah,
you
that's
lean
so
on,
important. Yeah.
that you really truly can trust, is so important. What is that?
What's everyone's favorite abbreviation?
Ooh.
My favorite is BIVA. IBA. Every time I come across it, I'm like, what is that? Please tell me that was not the intro.
That wasn't the intro. But I'm so happy that you guys are here. I'm glad we get to talk about USC and our experiences. We have Simran and Michelle here to discuss all things USC with us. And so I will give you two the floor to just give a brief introduction of who you are and what it is that you do.
Okay, I'll start. So hi everyone, my name is Simran. I'm a rising P3 student, born and brought up here in Los Angeles, California. Really excited to be here with you today.
Hi, everyone. My name is Michelle. I am a PhD candidate entering my third year. Wow. I did my PharmD here at USC Mann, graduated in 2022, and I'm really excited to talk to you guys about my experience.
First of all, I really just want to make a quick shout out to Michelle because, like, literally, I was sitting upstairs in PSC and she comes up, taps me on my shoulder, and she's like, I need your number. And literally, it's just been that was it from day one till now. And like, coming here to USC, you realize how important it is to have these people in your career, in your academic life, just in your life, period. Because having Michelle as a mentor, you need to do the burr, 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 because like she is amazing. She's amazing. She's amazing. I love Michelle. This is not to take away from Simran, but I'm just, if you haven't been told, then let me tell you right now, you're amazing. I'm like, if I can even fill a modicum of your shoes to the next person, I think I'll be doing a good job.
Guys, she's being modest. She's going to be even greater than I am.
Listen,
Just watch.
I have big shoes to fill. All right, so let's start off with just asking you guys about why USC. Well, before we even get to that, are you guys both like born and bred Californians? I know you are, Michelle.
Yes.
You too? Okay. So I'm expat, an immigrant, and whatever. I am not from LA. I'm a transplant. There you go. There you go. That's the word. I am not a LA girl. I'm a New York girly. So why, since you guys have been here, like California living all your lives, why USC?
That is such a great question. It's so funny because for undergrad, I was wanting to leave and experience something else. I ended up at UC Irvine, so not too far. But I was really wanting to come back to LA. And honestly, what really sold me on USC was the interview that I had. Every single person that I saw on this campus was smiling, looked like they were having fun. All of the faculty I encountered were super kind, were like really interested in who I was, asking me questions. Even after the interview, got calls from the students, like very intentional, like very organized and just really cared for. And so I was like, wow, everyone looks like they're having a good time. Like it's a 4-year program. There's so many things I could do. And so that flexibility and also just the environment and air on the campus really drew me.
Yeah, I saw Simran. You were at my interview process. And I would agree with you, Michelle, because I was like, is this real? Like, are y'all, because, you go to graduate school and it's not like, well, for me, my personal college experience, like, I've never had faculty members be so excited about a program and like the students actually going out of their way. Like, I got so many emails. I met Zach, who now like linked me up with the IPHO. And so, like, doing the VIP case competition. So it's just like interesting that that whole dynamic from the interview process like translated over to the actual school process, and they were still so willing to just like help you, guide you. So that really, I would agree, that's one of the selling factors during the interview process. And then one of the questions that they asked me during the interview process, which I thought was really cool, was like, what is your spirit animal? So I was like, that's a cool way to just like break it up. So, but yeah, go ahead, Simran.
I want to add on to like the interview process. I feel like when I came in before my P1 year, I loved it so much. I joined the student admissions committee the moment I could. And I loved that experience just as much that the following year I became the VP of admissions and recruitment.
Whoop.
Yay. So like coordinating that, planning that, just and helping the students who are coming in and like easing their nerves in the beginning, I found that to be like the most challenging, but honestly the most rewarding part.
Yeah.
Because they came in jittery, they couldn't eat, and we gave them like a nice lunch and everything.
I don't know why they try to feed us though, because it's like we're on an interview process. You have these numbers. We're going from room to room. It's very intimidating.
It is.
Yeah.
So, but yeah, go ahead. Sorry.
I think you need the food though. Like, you know, you're going around campus, you have the campus tour, you're talking in 2 different panels, then you have like the dreaded interview. You don't want your tummy grumbling during the interview and stuff like that.
True.
And
That
it's
is
what
true.
I had when I was super nervous. So, but yeah, things like that. I feel like it's super important. But, you know, calming the students was really important. But for me, I loved like the location. You like always highlight that. I'm very inpatient focused, very hospital based. So the fact that we have 3 hospitals just on campus and we have the opportunity to work there, do internships, volunteer, so much more was the part that was so like appealing to me about the school.
Yeah, I would say when you say location, I would say like weather and like just the climate of LA, which I think was one of the let me say it was the number one selling factor because I was so tired of living in New York. I was like, if I have to take another brutal winter, I will be buried under the snow because the winters in New York are crazy. And then the summers in New York are hot. Like you could literally walk out your door and you're sweating. And so it's like refreshing to come here. Like we have a hiking trail that's like less than a mile away. Like there's so many things to do in LA. Like you have daylight. Yeah. I was like, this is great. So I think that was one of the selling factors for me for USC. And interestingly, like the USC was my last interview and the only interview that I showed up to like in person because it was like my top school. So I was like, I really wanted to get into USC. Let me see if like this is actually something that like, you know, suits me. But it was actually one of the best interview process that I had out of like all the other schools. So I was like, all right, USC. And then I got my letter and I was like, yeah, I got in.
Yes. I remember the moment that like I got in, I was on a Zoom class and it was like a 2-hour microbiome course. I don't remember anything. But that day I got the email at like 2:58. And what I did was instead of paying attention in class, which pay attention in class, I printed out like USC Trojans, like the letters. I cut them out and then I put them on my parents' TV and I just like, you know, taped them on. And then I had to go to work after. I was doing a half shift. And I didn't tell my parents anything. And they came home and I'm at work and they're panicking and they're like, who put the USC Trojan stickers on our TV? Why can't I watch TV? And I was like, guys, I got in, but I'm at work. I got to go. Bye. And then we came home and then we had drinks and like a good meal and everything. So
Yeah.
Do you remember when you got accepted?
Actually, I don't remember the exact moment that I got the letter, but I remember like so much relief because it was such a hard decision for me.
Really?
I was choosing between USC and UC San Francisco.
Okay.
And as you may or may not know, I wanted to do PharmD PhD. So I was looking at not only the pharmacy program, I was looking at the research that each school was conducting and like the kinds of things that I could do and the flexibility of schedule. And so USC ticked all the boxes for me, but there is the allure of not being in, you know, so close to home with San Francisco. So when I finally like made that decision, it was like so much relief that I got into both programs. That was really awesome. And was able to do research here. So I was really excited for sure. I don't remember exactly what I did, but I know I was happy.
I remember it. I was at work and I remember because like I was so tired of just working because I was like, I'm done. Like the job was just too much. COVID happened and it was just a lot.
Right.
And so I was at work and I'm like, it's been 2 weeks. I'm looking in the email. I'm refreshing. I'm scrolling. I'm double checking because, you know, this was like the school that I wanted to get into. And then I think it was literally around the same time, like 3 p.m. I'm like, literally 2 hours before I have to leave. And I see the email come in. And it was like, congratulations. I jumped from my seat so fast and went straight outside so that I could call like everybody under the sun because they knew like USC was a school that I wanted to be in. It ended up becoming a running joke because I got into all the schools that I had applied to. And so like when I would tell my parents, they're like, okay. I'm like, they were just like, I'm like, they're like, I didn't expect anything less. Yeah, you know what I mean? Typical Caribbean fashion. They're like, okay, so what's next? But they were super, super happy. But I just thought that was great. And honestly, like, I think USC was really the only school that I was like, oh my God, I got accepted. This is great. Because, it's graduate school, you kind of really know what you want to do. And like pharmacy, I only just really fell in love with it while working in cancer research back in New York. And so working with the pharmacists on the research team, I was like, you guys are smart. I'm like, because, people tout these doctors and like, obviously they go through so much schooling and yes, they're like brilliant people. But I think there needs to be a little bit more light shining on the pharmacist role because they
100%.
actually, right? They do so much, and I don't really think we understand the scope of practice, and I never really did, honestly, until I actually got into USC and we started talking about all the things that you can do with a pharmacy degree.
And I think there's actually so much more work that needs to be done, even from like a legal standpoint.
Mhm.
COVID really brought out. People have said this a lot, that at least for pharmacists, COVID was a like blessing in disguise. COVID did have a lot of negative aspects to it, but for pharmacists especially, it was a moment for us to shine and for everybody to see what our real potential.
Yeah, for sure.
Yeah. We were seen as clinicians and not just people who put meds in a bottle.
Right.
Yep.
Provider status. Woo.
You're talking about student experience, like a lot of us, right? We were involved in vaccine programs. I mean, I remember like taking out shifts. I was at LAC USC. I was at my job at Ralph's, like giving vaccines, and it really makes a difference. I mean, I had so many patients come up to me and be like so excited to see me as a Black woman giving vaccines. They immediately felt comfortable
Mhm.
getting those vaccines. And so I think even as students, like us being part of such a large public health, you know, program like
Mhm.
that was such a big deal.
I know. And like one of the things that they brought up was the fact that at the Dodger Stadium when they did all those vaccines, and I was like, that is really, really cool. Like the work, the efficiency, the effectiveness, the things that you guys were doing, the amount of people that they got to come out and get vaccinated. I don't want to go back to 2020 though, but I'm grateful for the positive things that have come out because of it. So yeah.
What actually surprised me about Dodger Stadium, because I had a shift there before,
Mhm.
was the speed at which things were going. It was a drive-through of people, and you would get, I think, 10 vaccines done in like 3-4 minutes.
What?
Yeah,
Yeah.
because it was just roll down your window,
Oh,
get
right,
booked,
right.
Band-Aid, move next station.
Wow.
You were just going.
Talk about efficient. See, that's what I'm talking about, the efficiency. And it's just so crazy that this has happened because quite frankly, I have to look at my photo albums to realize to like know what if anything happened after 2020. I'm like 2019, I don't even know what happened then. 2018, did it even exist?
No.
2017, are you even real? Like no. Anything it's 2020
Yeah.
and like that's it. But like how do you guys feel about you guys' first year as PharmD students?
That was a really eye-opening experience.
Mhm.
Most of my undergrad happened during the pandemic, so I was only really on campus for undergrad. I went to Cal State Long Beach. I was only there for about a year and a half.
Mhm.
It was really funny because I'd actually gone to study abroad in winter of 2019 going into 2020.
Oh wow.
I went to London,
Mhm.
and on my very last day, one of my classmates was like, "Have you guys seen the news? There's this weird virus in China that's like, respiratory, and it's like kind of messing with people."
Mhm.
And we're like, "Okay, it's fine.
Yeah,
We're all
yeah.
gonna be good.
We've lived through
nothing-
many things before.
Yeah, nothing's gonna happen." And we came back, and all of a sudden, one by one, you're getting news like this city, like something's happening. This city, something's happening, and I'm like, "Oh my god." And 2 months after that, the world pretty much
Shut down.
Yeah. So undergrad was really weird because it was mostly on Zoom.
Mm-hmm.
And then all of a sudden you come to a graduate program where the speed of education is like 7 times faster.
Mm-hmm.
There's so much more content being thrown at you. There's a lot more expectation from you.
Mm-hmm.
I felt like I was undertrained at that point because the pandemic kind of set me back a little bit
That makes a lot of sense.
to like educational basis. So
Mhm.
yeah.
Well, my first year of pharmacy school was 2018, so I'm a pre-COVID grad student.
Wow.
So,
It's like DC and AD.
Quite
Year before Christ.
I really am. But it was just such a different experience even then. Like I tell some of our PharmDs in our lab, I'm like, it was 8-hour days. We had 4 hours of class and more like 8 to 12. We had a 1 hour break and then another 4 hours of lecture. And that was like every day. But I remember like I met so many like great people and we would form these really cool study groups. Like I just remember studying for Dr. Marzayan's like immunization exam. Like we would like memorize like the, times that you give each different vaccine and peds, and like it was such a formative time. And it was so much fun. I think that was a great time for me to learn like work-life balance. Like we talk a lot about that now in this day and age. But like I was meeting so many people. I was like going to events, and then I was also trying to find time to study and making sure I was going to class. And so I think a lot of the things I learned about time management and like managing my life, I learned that year.
Yeah.
Yeah.
It was a crash course in time management.
Yeah.
Which I was a wrecking ball of fire because like it was just like study, and it wasn't any like free time, and it wasn't until like I started, okay, let me like go check out the hiking trails, let me go like text my brother and start like venturing outside, that it got a little bit better. But I feel like it's your first year, give yourself some grace, like give yourself some space to make improvements. Now I know going into my second year the the changes that I'll make and things like that.
Yeah.
So I mean, but like I know we were talking a little bit off camera about the study tactics that you guys were talking about. You guys want to talk about it?
Yes, I want to shout out. I don't even know if she'll ever listen to this.
You never know. She'll get it.
Dr. Whitney Focolade, literally thank you, because like I vividly remember having this exact conversation with her about how to like balance time, like what's the best study tactic I could do. And she was like, you just need to see the content at least 3 times. And I was like, brilliant. And so because I always went to class, actually, I was the one recording lectures for my class. So it was great because I would just watch lectures,
Oh, right.
I would be there as I was recording it. So that was my first time. Then I would make my own notes off the slides and the notes I took in class. And then I would review those notes a week, couple of days before the exam, depending on the class, and boom, I got it.
Yeah.
Like most of the content. So yeah, that was like a gem. And I highly encourage the students to do the same.
It's funny you mentioned like that triple exposure because I've been given that advice too, but it was a little bit different because for me, like we have a lot of asynchronous lectures that we have, and I don't know if they're going to go anywhere. I think they're going to stay within our curriculum now.
Okay.
I like to first get my like slide sets out on my iPad, which highly recommend. Good Notes. Yes.
Good Notes is the best.
Yeah.
No notability.
But I'll just skim through the slides. So 5-6 minutes, maybe super quick, not really retaining anything, just like for active recall purposes. Then I'll go through and watch the lecture. I like 2x speed, but your teach your own. And then I'll take proper notes. And then the key to what I think my learning is right once you're done watching the lecture, close your laptop, but don't close your iPad. Go through and read your notes from the very top all the way down one more time.
Yeah.
And I think that's what like solidifies everything in my brain. So right before the exam, when I do like my quick review, it's like, yeah, got that. I remember that. Yeah, I remember that. I got that.
And then you kind of like only focus on the things that like you like to commit to memory.
Makes sense.
Yeah.
That asynchronous material is so important.
Yes.
It is
Yeah.
so incredible.
Talk about OTC.
you need that real world experience, especially if you don't have a job. Like we were also talking about work being really helpful and like seeing what you're learning in class. And if you don't have a job, which is fine, you know, some people it doesn't fit in their schedule or what they want, but you need a way to like apply what you're learning, you know. So I know that they do case reviews. They also did that when I before COVID. In the BC days, we also did case review. And so like those were the moments where I could be like, okay, I have this hypothetical patient and I can see like how this drug would fit in with this, you know, like those are the moments where you can really kind of connect the dots.
Yeah.
Because I definitely like when they did the what was it? Like they had the acting out, like a student was like a pharmacist or somebody else was at the counter or whatever. And so I remember those. So we kind of did that similarly, I think.
Yeah, that's really cool. And I think also that helps with real life. I mean, like now I practice part-time as a pharmacist. And so like when I'm like reviewing patients' charts and I see like, okay, what's the chief complaint they came in for? I'm immediately thinking about those things.
So
Right? You know, like, okay, what are the things that, okay, heart failure, what are the things more? Like, where's the edema? You know, like, so it really helps to solidify again, like you were saying, like, okay, what are the things I'm supposed to be looking for? How do I know which therapies are the right ones?
Yeah, and like the best
Yes. And that is our job, right? As student pharmacists and as pharmacists is to help optimize patient therapy for people to their lifestyle and what they're experiencing, taking into account everything about their lives, right? Their social experiences, their financial experiences, their family experiences, and taking that into their health as well. And so, yeah, I agree. Having more realistic content like that would really help, you know, connect those dots for students. Like, okay, when I'm on the other side of the glass, because we've all been patients, right? You know what it's like. But being on the other side, right? You're not a patient. You're providing care.
Which is like a little daunting because now you have the patient in front of you that like you have to now administer all the things that they need and think back on all the things that you have learned from before. I would say, interestingly enough, the 631 class we took, the institutional, I don't know if that was the same for you,
The
Michelle.
longitudinal.
Yeah, the longitudinal class. I feel like that class, if it was maybe coupled with like PPP or like OTC, because I feel like I learned a lot. Because like for my job before I came into USC was like research oncology. So I was reading a lot of notes, right? And so like a lot of the notes I didn't understand because I didn't really need to look at that information. But like that class in particular, and then OTC with the referencing of the drugs and things like that, and then PPP with the prescriptions that they would administer, and then the soap notes. I feel like all of that would have been like a kind of a good class to like maybe cross over at some point. It could be separate classes, but maybe you have a crossover class where you like soap notes, we talk about OTC, and we talk about the prescription medications that they're being administered, so we can get like a holistic overall view of like, this is the patient, this is what it will look like kind of thing, you know?
Talking about like soap notes, have you guys seen how ridiculous some of those abbreviations are?
It's like ABC, CFF.
I used to quiz myself.
Really?
Yes.
PMH, what is it?
Look, past medical history. But also, guys, it's really a marathon.
For real.
You're always gonna come across some doctor's notes where you're like, what is that?
Right.
Okay.
What is that?
What's everyone's favorite abbreviation?
Ooh.
My favorite is BIBA. IBA. Every time I come across it, I'm like, what is that? It's brought in by ambulance. And I'm like, okay.
I don't even know. Honestly, it really just looks like a bunch of alphabet soup is what I find it.
I would say my favorite one is QD because I actually use that in real life.
Oh, true.
True. Catch myself like when I'm texting somebody else because I'm like, oh, you're not a pharmacist.
You gotta do daily.
I don't know QD.
That's funny.
Yeah, but like it's so funny in my own research notes. Like you'll see like QR. Like,
I guess like, so you said QD and I think I might do QS only because it's bedtime and I'm like, let's go to sleep. Take your meds before you go to bed.
Girl, Bedtime is QHS.
See, I don't even know what I'm talking about.
I was like, QS is quantity sufficient.
Yes. Oh, see, there you go. You paid attention to class.
Go
But
to class.
see, that's a side note. Speaking about the first year, what's your favorite class? And then what maybe is not your least favorite class?
My favorite class all time
Mhm.
had to have been PPP1.
I agree.
Yeah, and a lot of students actually, if you ask around, they probably hate that class.
Yes.
But
That
I
was not.
Yeah.
But for me, I felt like that was the one class, your P1 fall year, where
Mhm.
you truly learned what a pharmacist does. PPP taught me how to do blood glucose testing. I was poking other people's fingers, right? How to give a vaccine, how to take hypertension.
That was scary when we had to do it with each other.
Yeah.
I was like, I have to do what?
Uh-huh.
With
Yeah.
who?
Yeah.
I remember when I was getting poked, I was here, gave you my finger, and I'd look away like this because I was so petrified of a little lancet poking me.
But it hurts. It's so
If
bad.
they do it correctly, it's
Yeah,
supposed to.
it's not supposed to. But that was daunting. But I also like that experience. I can go in and I'll never forget how to immunize. You know what I mean? Or like do the glucose testing or like anything else because I have that hands-on experience and now the muscle memory is just there, so I just remember.
Yeah.
Okay, so your least favorite?
My least. How about we go with your favorite? I have to think what my least favorite is. I had P2 year as well, so I got least favorites there.
Yeah, and it's fall and spring.
Yeah.
It's not just either or.
Yes, you're right. I would say my favorite class. Okay, so it's tied for me. I loved the cell metabolism class with Dr. Cadenas.
You are the only one. The
loved-
only one.
Guys, when I tell you, like, I drew out the whole like glycolysis and PPP pathway. Like, I did a whole
Why?
beautiful chart, which I had to throw away when I moved out.
Why? Did you throw it away?
I know I shouldn't have.
You should have laminated it and sold
It was
it.
a piece of art, and also he's wonderful.
Yeah,
He's such a wonderful.
yeah. I agree.
But my other favorite would be OTC because I feel like that's when I really got to like get into the nitty gritty of like being a pharmacist.
My class would say the otherwise.
But it was cool. I loved it because like, oh my gosh, I could talk to my family about Tylenol.
Yes.
Actually talk to my family about things that they use and like I'm learning all this cool stuff. So I think I loved that aspect. I would have to say my least favorite was calculations. Which is that first year?
Yeah.
That was my least favorite. I was like, it's so much math. And
Yeah, I am
it's
terrible.
also like the grains math. I was like, this is the conversions. It
I
took me
know.
a while to get on board with that, but I mean, it's obviously very important. So I think I struggled a little bit in the beginning, but then got the hang of like the types of math that pharmacists need. Yeah, but it definitely was not my favorite.
I do think though that if I was in a job role that was doing the calculations, like to see it while I was learning it would have been like extremely helpful.
Yeah.
I probably would say the same about my least favorite, tied with maybe biosys, and not because biosys is a bad class. It's just like why? And it's also just like I was telling Simran, I was like I would have appreciated if we had like the clinical relevance, like the clinical aspect of it to the organ systems.
Yeah.
Because I feel like okay, well like see like the crossover with OTC or the crossover with PPP, like these are the drugs for your heart failure or AFib or whatever, you know what I mean?
Yeah.
So that would have been cool, but I would say my favorite class, I think I agree with you, is PPP because that was a class that I was like, okay, this is what pharmacy is actually about. And like shout out to Dr. Mazine because she is like I always liked when she would like present in the class because she always had come with these real world experiences. She had amazing stories to tell. So it was always just nice just like hearing her experiences, talking about it. And she was always very encouraging with especially with people coming up to speak, which I'll get over it soon. But, I really enjoyed her class just because, it wasn't just like reading stuff off a PowerPoint. It was also reading stuff off of a PowerPoint, but then she'll have like the clinical knowledge to like apply that to real world experiences, which I thought was like extremely helpful. Yeah.
Which my least favorite,
Oh, now you got it? You got it?
med chem.
Yeah.
Okay, I also loved that class. I loved that class.
So you liked pharmaceutics too?
Yeah, I
Yeah.
love pharmaceutics.
I did though.
Pharmaceutics
I
was
did.
great.
Pharmaceutics was cool.
Medchem, I think the way that it was taught was not a good way for me to learn the content.
Okay.
It was something that I struggled with, and it was a short course, right? It was only 7 weeks. I feel like it took me about 4 weeks to just learn the way that that professor taught us.
Yeah.
Right? So until then, I was just like, what am I looking for? What am I supposed to study? I couldn't figure that out because he gave you a sheet on a Monday, and by Friday you had to know every little PK value and everything. That's how our quizzes were pretty much. I didn't know what I was looking for at that point because I felt like I wasn't guided the correct way. So I was just complete blur. And the class ended and I'm like, I know this material, but how do I know this material? I have no connection.
I will say I did have maybe a leg up on you because UC Irvine, we actually take lots of chemistry.
Wait, what was your undergrad major?
Pharmaceutical sciences. So that's sorry. I had a tiny bit of a leg up on you because my final year of my senior year of undergrad was the first year of pharmacy school, essentially.
Okay.
So we took pharmaceutical sciences and medicinal chemistry in my senior year. So I knew a lot of the things that Dr. Hayworth was still teaching.
Yeah.
So don't feel bad.
Got it.
He was good though. I did appreciate how he presented the topics, although he would get a little nitty gritty with the stuff. But obviously he knew what he was talking about, and I never had a problem when I would go up to him and maybe ask a question. And he was great at trying to break it down and answer it. But honestly, I think with pharmaceutics 2 and 3, MedChem kind of helped me with 2.
Yeah.
Because it was a lot of the structures and things like that. And so there's a little bit of crossover where I was like, oh, we learned this in pharmaceutics. Okay, I kind of get this in medchem. There's a little bit of application of both. So I thought that was cool. So we talked about our least and our favorite. Now, if you can describe your first year in one word.
One word. Chaotic.
That's a good one.
Very chaotic.
That's a good one.
Yeah. Never knew what to expect. When you move into P2, my favorite was when you take a therapeutic course at case conference. So case conference happens once a week, and the case that they develop is based on what you learn in your therapeutic.
Oh.
So if you're learning about, I took CNS at one point, and we were learning about bipolar disease. Then that week for case conference, it was connected, and you would have a case about bipolar disease.
Cool.
So it would help with both classes. P1, I was just here and there. Yeah, just a blur.
I would say my word would be formative because I think that a lot of the experiences I had during that year actually solidified who I am today as a practitioner. That year I realized hospital wasn't for me. Hospital was the first rotation I had, and I was like, this is wild. I had so much respect for the pharmacist, but I'm like, you're in a room, the oncology pharmacist that I saw, I was like, you're in a room 8 hours a day checking chemo.
Yeah.
I respect you. I could never do that.
Yeah.
That's not for me. And then, but also I started my internship at Ralph's and realized community pharmacy was a thing. I did not know anything about that. I think learning about community, learning about outpatient and ambulatory pharmacy, I realized I love people. I love talking to people. It's my jam. And that
Bless your heart. No, seriously, because I can engage with people. I wouldn't go as far as to say I love everybody. You know what I mean? Just the nature of my personality. I'm just keeping it real. Yeah. But you, even talking to you, you can tell that you're very engaging. You're the type of people that a patient want to come into the pharmacy and see and talk to. Because I mean, not to knock, but I've had pharmacists where it's very dismissive. They don't really want to answer your questions, or they're just really trying to get you off there because they want to go to the next patient. And so if I saw you and you came in and I needed a question about some prescription, I would leave feeling very informed, very happy, very confident. And so that is what we need to instill that kind of stuff in our patient and their confidence for taking their medication and stuff.
I feel like patients would come to your pharmacy and they'd come up to the window. they wouldn't care who the pharmacist is. They'd be like, "Can I talk to Dr. Kalu?"
Yeah.
Those are the type of people you're gonna get.
They're like, bypass everybody else.
I don't care who else you are. Get me Dr. Kalu now.
Yes.
Yeah, I mean, I think that's what I love about community and ambulatory care is you can form relationships with your patients. There are people that you see every month if they're coming to pick up their prescriptions or if they're coming to get vaccines, and you get to know them, know about their lives, and I think that's what I really loved, and it really helped me realize like, oh, this is the kind of work I would love to do with the pharmacy. I definitely want to be engaging with students. I want to be engaging with patients, and like. So I would say first year, all the experiences I had really allowed me to realize, like, it was hilarious. I came in thinking I wanted to be an infectious disease hospital pharmacist and quickly realized that was
Not the way. Not the way.
but I mean, I'm wearing my micro shirt. I love microbiology. I do infectious disease research. And so I still love aspects of that, but I think there's so much that you explore as a first year that can be formative, like puts you on a path.
Yeah. I was telling Simran, I don't know if it was recorded at the time, but I was saying that I lost my train of thought. That's funny. It's okay. We'll segue into something else. But Michelle, I wanted to get your I wanted you to talk about your research that you're doing. You said that you're a third year PhD student. Can you talk a little bit about that?
Yes, and I do want to shout out my mentor, Dr. Annie Wong Behringer. I've been with her since 2018, since I started, and she took me in. But the research I'm doing right now is I'm studying recurrent UTIs in postmenopausal women. And so for our non-healthcare people, that means women over the age of 50. They don't have their periods anymore, and so we call them postmenopause. And this particular population is very high risk for getting recurrent UTIs. There are so many factors that other amazing people have studied. But what I'm studying is the interactions between the antibiotics that they're getting, the bacteria themselves, like how they evolve to just stay in the bladder and in the tissue. And then the host, so the bladder's immune response, like what's going on with that when they actually first identify the bacteria, like how are they responding, how do the bacteria respond to the immune system and then to the drugs themselves, in hopes that we can elucidate like what drugs are actually best for these patients that can actually clear these bacteria from the tissue and also support the immune system as it should. And so it's been really cool. Right now I'm in the middle of creating a 3D model of the bladder in little what we call trans wells. It's really cool. I'm trying to recreate a really cool study that was published last year that used adult stem cells from an adult human to create different layers of the bladder and basically study how the bacteria are able to reside in those cells. And so I'm essentially doing the same thing, but I'm going to use therapies that we use. And you're about to learn, you guys aren't, you finished your third year, you're about to learn the antibiotics that we currently prescribe to these kinds of patients and why are they not working potentially in this context. And then what are the ones that do work? What are the drugs that actually are able to clear the bacteria?
Yeah, so we could get like a first line that works universally, maybe even if it's not 100%, but we get somewhere there,
Yeah, that we can know. And what's cool is like as a pharmacist, I also know about the patient relevance of these drugs, right? I know what adverse events they cause in patients and maybe certain populations within this larger population that I'm studying would benefit from specific medications. And so what I'm really trying to get at is like tailoring antibiotic treatment for these patients. If a patient comes in, she's over 50, she's already had so many UTIs in her past, then great. I already have that information and I can already off the bat recommend an antibiotic for you that hopefully with this research we know would work. And so I think that is the future. We talk a lot about precision medicine right now in research. That's because we know that not every medication works for everybody. It's really unfortunate. I mean, right now, like the studies that I've read and seen over 20 to 30% of women experience recurrent UTIs despite antibiotic treatment.
30%.
Which is crazy.
That's
That's a lot of people.
That's a lot
That's a lot of people. And the numbers are even more staggering if we include worldwide, like we're just talking about in the US.
Yeah.
So I think I've become very passionate about women's health and the part that I can play as a researcher, but even as a pharmacist, to use the knowledge and the things that I've learned to help that population of people.
Yeah, that's amazing. I want you, because I know when I first saw you, you were speaking about your first experience in your PhD year and how it didn't really go so well in the beginning and how you had to kind of transition to something else.
Yeah.
Do you want to talk about that a little
Yes,
bit?
and I hope this will encourage you guys because, man, I went through at least 2 iterations of my research project. When I first started with Dr. Wong Behringer, I was studying carbapenem resistance. So carbapenems are a type of antibiotic we use for multi-drug resistant infections. And that project really quickly hit a dead end in a year. And so I had to come up with a new idea to study and was partnered with a ID fellow at the time to study this case where this gentleman, unfortunately, had a multi-drug resistant urinary tract infection for 4.5 years. Wild.
Wow.
So I was in charge of the molecular studies. I was looking at the gene expression, differences in metabolism that occurred in these bacteria that evolved. And it was a really cool project. And I was wanting to say that further, wow, these bacteria stayed in this patient for 4.5 years. How did they survive? And I was really wanting to take that on and again hit a dead end. And the wall that I hit was actually in my first year as a PhD, which is
devastating. Yeah.
And as PharmD PhD, you're trying to get to your qualifying exam, you're trying to move forward with your project and with your thesis, and sat down with my mentors to go over the data I had collected so far, and they were like, you need to start from scratch. And so sometimes you have to make that call, and it can be hard, especially when you're really attached to your work, to know when to start again, or when to push through. But that was the call that I needed to make. And it was really miraculous, honestly. I really thank God, and I attribute it to God, because that happened May of last year. And I was supposed to take my qualifying exam in July. And so within 2 months, month and a half, got this idea to study the efficacy of antibiotic therapy in the recurrent UTI space, focusing on postmenopausal women. I have a lot of friends actually that are postmenopausal that I know as well. And so it was something that I was really passionate about. It would allow me to use my pharmacy knowledge.
Yeah.
Something I really wanted in my research work. Presented this idea to Dr. Wong Behringer, and she was like, this is me.
Yes, this is it.
This is the one, write it up. So I was like, yes, ma'am. Went to work and, was able to do my qualifying exam in August, finished my oral exam and passed in October. And so, yeah, it just goes to show, don't be afraid of failure.
Yeah.
It really, and honestly, those experiences really helped me because, through that process, I was able to learn, okay, this is what it takes to build a project from the ground up. These are the things you need to think about. And, not just thinking about, the people it's impacting, but also the resources. Where are you going to get the resources from? What's available to you in the moment? And so that's what I really love about the PhD is just I've learned so much about just project management, working with people, resource management, and then also finding passionate things to do.
Yeah.
Sometimes you hit a wall. It's unavoidable. You're working in a space, wherever it is, and you thought you had a good idea. You probably did, but for some reason it fell flat.
Yeah.
And you just have to learn how to pick yourself back up again.
And rebound.
Yeah. And so for me, the answer wasn't quitting the PhD program. The answer was, okay, I'm going to figure out, a way, and I'm going to pray because that's what I did.
Yeah.
And see okay, how can we move forward?
Yeah. I'm so glad you said that failure shouldn't be the reason why you want to drop out, but figuring out a reason other than what can you use this failure to propel you? What mistakes can you learn from? What can you even take from it, if nothing at all? But like, your first answer shouldn't be to just drop out of the program. It should be like, I'm going to try, I'm going to try, I'm going to try again.
Yeah.
So I think like kudos to you, because I remember when you were up there speaking to us about it, and I could tell that like that wall was devastating. But then to hear you talk about the research that is actually working and that you're actually doing, and then just your excitement with the bladder model,
Yeah.
I'm so glad that you had that breakthrough.
Yeah.
So that's great. And I know, Simran, you're at Norris. Are you doing any research? Can you tell us a little bit about that?
Yeah, so I'm actually going to be using it for my scholarly project, but I'm working on a phase 3 clinical trial for refractory AML.
Ooh, wow.
Very cool.
AML is a type of leukemia that happens in patients of all ages. So yeah, I'm working with my partner and we're really excited to see the results. We just finished a big part of our data collection with a lot of the patients. So it's a retrospective study. What that means is these patients have already received the treatment. We go back like into their files and into their charts, and we collect like the nitty-gritty information. That was such a difficult part because
What sort of information were you collecting?
exactly, that's like the really hard part because you don't know, all these patients have different backgrounds. They might have been diagnosed at Norris. They might have been diagnosed at an OSH outside hospital. Had to learn that abbreviation too. And you have to read it in their notes, figure out what happened, like where they got diagnosed, go into that hospital's records, figure out when they got diagnosed, how they got diagnosed, what their primary symptom was that kind of set them off, like, maybe I need to go see a doctor, go to the ED for this.
Yeah.
So we were collecting information like that. Then it got into the more like difficult things, like once they have a bone marrow biopsy, bone marrow you get inside of your bone, and then you test it to see how those like stem cells are changing or how they're not changing. Figuring out those abbreviations and what each of those words meant, whole other story.
Yeah.
I'm an upcoming P3, so I still haven't taken on the oncology module, so I have no idea how this works. But, figuring out all the little mutations that there are, what that means for outcomes and prognosis, like that's what I really struggled with. But figured that out, learned how to read like a biopsy report. Then what was the first line treatment? Why did that first line treatment not work? Yeah. Why did they end up getting this drug? It's called Vyxeos. I love it because it's purple. Purple's my favorite color. But yeah, so then after that, did they go through a stem cell transplant? Who was their donor? How were they conditioned? Meaning, how was their body prepared to be able to take on this stem cell transfer, to happen and stuff? Did their body accept it? Did their body reject it? Did they go through something called graft versus host disease?
Terrible. That is a terrible thing to go through. Yeah.
How was that managed? Was there prophylaxis? And you're doing a retrospective study on patients who might have had this treatment for like 5 years ago. And then you have to like go through every treatment that they've had ever since then. Every prophylaxis,
That's a lot.
every treatment that they've had.
And their histories, especially for oncology patients, can be extensive. Very, very long. And like AML is one of those tricky ones where it can progress from MDS. And then it's like your mutations, like the FLT3. And then you have that, learning how to read the biopsy report. That was my bread and butter at like.
Oh, she's right now. She's
She
at
knows.
I honestly can't wait for that oncology portion. Like everybody keeps telling me about that, and I'm just like so excited.
Because shout out to Dr. Amir. He's amazing.
I believe it because I feel like no one really had anything bad to say about that course, and so I'm really excited. But that's also like really cool what you're doing, and I know that's a lot of work because looking at all of that data is insane. So it's really cool. Do you guys have any other like interesting projects or assignments that you've worked on like in school, outside of school, separate from Norris, separate from your PhD?
Well, I know you're about to shout out the project that we worked on together, which is the first ever HSC Black History Month block party here. Guys, she shouted me out. I'm going to shout Melissa out.
Thank you.
She is Autumn and I's successor to the Black Pharmacy Society co-liaison. So she and EIL, wonderful people who are heading up that affinity group. I it is an organization.
It's an organization.
To me. But yeah, we we had an amazing team. Melissa was on our team last year that helped put that on for the first time. We collaborated with the med school, with OT, with some wonderful vendors and community partners. I mean, it really was like the ultimate team project.
Yeah.
You know, the ones you want to do. And it was so cool. Like, so many people came out. Like,
Yeah.
it was great.
The support was just amazing.
So much support, and it was really awesome to be a part of that. I am now taking a step back to focus on finishing my thesis, but still wanting to be a part, and I'm really excited for what it's going to be. I know that it's going to get even better.
That's a big shoe to fill, but thank you. I appreciate it. I'm trying to make it different, but also better. A shameless plug: the Black History Month block party will be held on the last Thursday in February. So mark your calendar.
Come out. I want to see every single one of you.
Food. We had some amazing vendors. There's a lady that was putting candles that look like Fruit Loops. So yeah, please mark your calendars and come. Do you have any interesting topics or assignments?
Something I've been working on is co-founding a new organization on campus.
Okay.
It's called SASP. It's the Student Association for Specialty Pharmacy.
Ooh.
Yeah, and I think it ties really well into like my interests, but also appeals to a lot of other people who might be like non-oncology related, because specialty medicine is immunotherapies and these gene therapies that aren't really common, very expensive, and require a lot of like authorizations and paperwork and stuff. So just bringing that out to the public, and it's something that everyone is learning together. You can't expect your professors to be experts on it while they teach you. And I think that's why having this org on campus would be so amazing.
Yeah.
Because we plan on doing like case studies and topic discussions about these like new types of drugs.
I like that. I think we need more of that, like the cases, especially the discussions, and discussion in a sense that like you back and forth with questions and like engaging with both students and like the faculty. That's great. But keep going, elaborate. I'm excited about this.
Yeah, so we're still like founding it. We're trying to figure out where we want the org to go, but ideally we wanted to bring it onto campus because we feel like there's a lack of representation. I feel like in pharmaceutics, we learn about like drug delivery and the different modes of that, but you get very few real life examples. With SASP, we hope to kind of partner with, what you learn in pharmaceutics, take it a step forward, and then actually introduce you to those drugs that come out right out of the pipeline. If you look in the pipeline right now, there are thousands of drugs and therapies that are like, almost ready.
Yeah.
A lot of them are going to hit that brick wall and they probably won't come out. But if you see the way that they were developed, why they were developed, what target population they were developed for, I feel like everybody is going to be able to relate to like at least one of those therapies because they fall in that category.
Yeah, absolutely.
So yeah, that's
amazing. Amazing things are happening here. I love that. Okay, we're going to do a little bit of rapid fire questioning. But before that, I wanted to but first say that like the things that you guys are doing are amazing. And myself, I'll little pat on the back.
Yeah. Plug yourself.
But I think for the people that are listening, especially like the incoming students or current students, let's talk about like, what did you guys do? I know it's a hardworking program. Like, it's not easy. How did you guys protect your mental health? What did you guys do? What did you guys implement? Let's talk about
my like two staples have been sleep and meal prepping.
Oh yeah.
Sleep for me, I realized without 6 hours, I cannot function, let alone like come to class and be present in class
and pay attention.
Kill that all-nighter habit
for real
quick.
It doesn't work.
Tell every single student out there, do not do it.
Yeah. And for me, if I don't get 6 hours, I notice that it ruins that day for me, and it also ruins the next day because I still feel like kind of lethargic.
Yeah.
And then that second day, I'm going to fall asleep at 4 p.m. Yeah. So I will lose a lot of precious time.
Yeah.
And on top of that, this was my first time moving out of my parents' house ever because I didn't really get to do that for undergrad given COVID. I was, it was a reality check because I had to do my own laundry.
Yeah.
I had to clean my own toilet. I had to make food for myself. I can't live on Taco Bell, which I know you don't like, but I love Taco Bell. Like, I can't live on food. But learning that if I eat Taco Bell every day, I'm gonna notice my body wear down. I'm gonna notice that I don't have energy, that I'm gaining weight in places I don't want weight. And literally 2 weeks of meal prepping cutting my own broccoli and putting it into my meals, I saw that weight drop like that.
Yeah.
And I saw myself gaining that energy back, being more connected to myself, spending more like quality time in my apartment and not just, you know, door dashing stuff.
Yeah.
Yeah, so I think eating healthy and meal prepping really helped me get that protein, people. Love it. But yeah, so just eat healthy and then sleep. For me, at least 6 hours.
No, yeah, the sleep is important. I am a monster if I don't have any sleep. I just want to like, ugh, I can't.
Yeah.
My brain literally is like one brain cell left that's like alive and well. But yeah.
I would say the way is not studying 24 hours for sure. Making sure you're doing something fun. And then having a support network. I think like moving and doing my PharmD and PhD at USC has been game changer because I've been able to connect with my parents and my family. I've made some really cool friends.
I love that.
In and outside of pharmacy school. Shout out to now Dr. Avantika, who like we were like this, like especially in third year, guys. Third year is rough and
So
tough.
hard.
Okay,
Good luck, Simran.
so like just having like really good friends that you can study with, that
that's
you
so
on,
great. Yeah.
like that you really truly can trust. Is so important. And I had my non-science friends and I had my science friends because y'all sometimes you need a break.
Yeah,
seriously. Not gonna
say that
talk
again.
about,
Say that again.
Whatever cardiology drug. Like you need somebody that you can have a normal conversation with. Like I think that's so important. And so I think those are the things that really helped me, is like really learning how to incorporate fun into my weeks. And a lot of the time I wasn't great at it, but like as I learned, I could feel myself getting better, you know?
Yeah.
Just like feeling better about what I was doing.
Yeah. I would agree. So for me, like with balancing my mental health, I would say that reading, because I just liked, like I love reading. I mean, like last year I read like 20 books. But reading was one of those things to like break up the monotony, and then also to kind of like separate. We're doing pharmacy, but I don't want to read everything that's pharmacy medical related.
Yeah.
So just reading something that I enjoy, that's fun, was like a great way. And then I would sit outside or I'd go to the park and just like read, which is a nice way to kind of break it up, but also just to keep yourself in check, get a calm place, be calm kind of thing. So yeah, but I think it's really important that we reach out. Shout out to Veronica Acosta, who is the wellness coordinator for our program. She is amazing. Please do not hesitate to talk to her if you are struggling. She is great. But yeah, so last question. We're gonna wrap this up. I really appreciate you guys coming out to talk. It was really nice having this conversation with you guys. So let's the generic question. If you could go back in time and give yourself one piece of advice,
The
what
back
would it
to the
be?
future.
Yeah, the back to the future.
For me, I think if I could give myself like a piece of advice, I would tell myself, don't take on more than you're comfortable with. You will see my name in every corner of this.
Just look at her signature, guys.
It is crazy. And I think that was actually like a good thing about the school, where the opportunities were endless. Like there was every door that people were opening for you. I felt like in undergrad, I had to look for opportunities, open my own doors. I couldn't. Here, the doors were just open.
Yes.
Pick a door.
Yes.
Yeah. And I felt like in my first year, I started to say yes to all of these things, not realizing what the time commitment would be.
Yeah.
Count those
So
costs.
important.
Yeah, 100%. And I backed down from a lot of them. And I feel like now I'm in a place where I'm comfortable with all of the things that I'm doing. And I admit I am doing a lot, but I'm able to manage it with my social life, with my sleep, with my friends, with my education, most importantly. And I'm happy with it. But in the beginning, I really wish I like limited myself. And I had the courage to say no.
Yeah.
Which I had to learn a really hard way.
Yeah, that's important.
It's really good. I would say my advice to my past self and hopefully some future selves would be to just really have fun. Like you have so much time to decide what you ultimately want to do. And I think just don't put so much pressure on yourself to have it all figured out. I think I put a lot of pressure on myself during pharmacy school to just be the best and to have the next 10 years of my life like, figured out. And when I didn't, it was rough. And so I think allowing yourself to just enjoy where you're at, try new things, even if you might suck. Like, just try it, because even just you not liking something, that's information
Yeah,
that you
true.
can use. And then you tried it, So I would say, yeah, take it seriously, not too seriously.
Yes, agreed. I would say for me, my advice that I would give to my past self, or well, still myself and future selves, is just to give myself grace to just it's okay to make mistakes. You
Yeah.
will live and you will learn.
Yeah.
And I think that's important because I get very frustrated if things don't go right,
Yeah.
or if this is not going my way, or if I'm not figuring this out immediately. And I think that also can hinder your growth in everything. So
Yeah,
I would just
sure.
say just to give yourself grace.
Yeah.
But I really appreciate you guys taking up the time out of your busy, busy schedule to talk with us.
No.
I hope that you had just as much fun as I did. And so it was nice talking to you guys.
Yeah,
Thank you.
likewise.
Yeah. Thank you for having us.